it's Dr. Tracy. Today we're going to talk about oral tumors in dogs and cats. These tumors can be benign, meaning that they're just locally invasive and they're not spreading to other areas, or they can be malignant and cancerous. And of those, they can be more commonly locally invasive, meaning that they're invading bone and tissue and everything like that, versus they can actually spread to other areas like the lymph nodes and lungs in dogs and cats. The most common oral tumor we tend to see in cats is a squamous cell carcinoma. We also see that in dogs, but a more common cancer we tend to see in dogs is the malignant melanoma. So a lot of times people say, well, how am I going to know if my pet has an oral tumor? Every animal's a little different how they present. And again, I always tell people they don't all read the books, but a lot of times you'll notice your pet shifting food in their mouth. So they're trying to eat from one side versus the other. Sometimes you can see some bloody drool or even some blood dripping out of their mouth. A lot of times you can see pets pawing at their face because the tumor is annoying. Even sometimes you can see a tooth fall out because a lot of these tumors tend to invade bone, and all of a sudden you'll just see a tooth on the floor, more common in cats than dogs. Or you can even see swellings of their face, or sometimes you'll just catch a bad odor to their breath, or you might even notice that their jaw seems a little more disformed. Usually doing oral exams on your animals, especially cats, on a weekly basis is not something that most people want to do, and it's not something most animals enjoy. However, if you do have them used to getting their teeth brushed from when they're really young, a lot of people will notice these much earlier. However, the treatments are usually the same. Now, once you do notice an oral tumor, or if you brought your pet in to your vet because they were dealing with something odd going on in their mouth and they're diagnosing or suspect an oral tumor, the very first thing they're going to try to do is take a biopsy or a fine needle aspirate of that and see if they can figure out what type of tumor it is. Now, a lot of times because these tumors are locally invasive and there's a lot of angry tissue around there, getting a diagnosis on just a fine needle aspirate alone with just a little tiny needle is pretty difficult. A lot of times they come back as inflammation. So most times, because an oral tumor is usually found when it's more aggressive, your vet is going to recommend sedation, clean their teeth and take a look at their whole mouth while they're under sedation, and then they're going to take some biopsies, or if they think they'll be successful in removing as much of that tumor as they possibly can, they will do that as well while your pet is under anesthesia. So as far as cats, the most common tumor is squamous cell carcinoma, and that's the most commonly diagnosed one. There are also fibrosarcomas, osteosarcomas, and a lot of different other tumors, but the squamous cell carcinoma is the most common that we find in cats. In dogs, the most common usually is melanoma, although we can see squamous cell carcinoma pretty frequently as well. No matter what type of oral tumor your pet has, unless it's a little papilloma or a viral wart in your dog, which can spontaneously go away if they're crushed, your pet usually is going to need surgery. Now, the type of surgery depends on at what stage this is found, as well as what type of tumor it is. I'll go a little bit more onto malignant melanomas in dogs in a minute because there are some other new therapies you can do, but most commonly what your vet is going to recommend is have an orthopedic surgeon come in, and they're going to either remove as much of that tumor as they can, or if the tumor is invading bone and teeth, they're actually going to recommend removal of part of your jaw of your pet, which is, as you can expect, a very prolonged recovery. And generally, once the tumor is removed, the vet is going to send it out to a histopathologist to have it staged to see if there is chances that they got all the tumor, which would be great, or if they didn't, and then they have to go back in and remove more of either the jaw or upper area of the jaw. Sometimes it's a half a mouth, sometimes it's half a jaw. It depends on what type of tumor it is. And usually they'll have that discussion with you before to talk about complications and at how much risk they think that this is for spreading. Malignant melanomas in dogs do have a very high rate of spreading to the lungs, the local lymph nodes in the neck, and other areas of the body. So if that tumor is very advanced in your dog, they may not recommend pursuing surgery. Squamous cell carcinomas in cats generally tend to be more locally invasive, so sometimes surgical removal can be curative, but again, it is a very long recovery for your pet. Many times, depending on how invasive that tumor was, your vet may also refer you to an oncologist, and they will follow up with radiation therapy. There is also immunotherapy, where there's actually a melanoma vaccine that has been known to increase survival rates in dogs, that may be recommended as well. Usually that's a conversation that you have with your oncologist first, to find out if your pet is a good candidate for that. So once diagnosed, your family has to decide, are they going to pursue more aggressive therapies, radiation therapy, melanoma vaccine, or are we going to take more of a hospice approach and just try to keep your pet comfortable? In some instances, no matter how much you want to pursue, sometimes your vet is going to say, you know what, your pet's not a surgical candidate. Unfortunately, these tumors tend to be found when they're very advanced, and we can't remove the entire mouth of your pet in order to save them. That's just not a good quality of life. Or many times it's spread already, and they're worried about your quality of life of your pet after surgery, and if they're going to survive long enough in order to recover from that surgery. So in my experience, as far as survival times, they all depend on the stage of the tumor of your pet, and when this was found. If it was found early, even if you don't pursue surgery, or if you are pursuing surgery because you found it early and they think they'll have a good success rate. Generally, most of these tumors tend to be really aggressive, especially your melanomas in dogs. And we're looking at months to maybe half a year for survival time. We don't generally get really good survival times with oral tumors, mainly because as it invades more of the bone, it causes problems with your animal's eating. So the most common things people will say, well, what do I look for? You know, I want to know when it's time for my pet. If we can control their pain and keep them eating, a lot of times we'll have to switch over to a canned food and then eventually a gruel, just to try to get stuff in them so it's easier for them to get the food into them. If, like in cats, the squamous cell carcinoma is invading the tongue, a lot of times they can have difficulties just getting food into the mouth and swallowing. So we have to make sure that your pet is getting enough nutrition to keep them going and keep their energy up and allow them to fight this cancer as best they can. Generally, your pets need to eat at least 2 to 3 times their normal calorie intake just to keep weight on, because unfortunately all the calories they tend to take when they're fighting cancer goes to feed the cancer. So it's really hard to keep weight on these guys. So you are going to see that your pet is going to be progressively losing weight as the cancer goes on. And you are eventually going to start to see that muscle mass wasting, and they're going to be getting more weaker. So the things that you want to look for is your pet able to eat food? Are they able to swallow? Do they have swollen glands in here? You need to make sure that those glands aren't impeding their ability to swallow. A lot of times too, you're going to see bloody drool. You can even sometimes see really dark coffee ground like stools and or vomit because they're swallowing blood a lot with these types of tumors. Unfortunately, mouths bleed a lot, so a lot of times you're seeing a lot of blood. The other thing is are they able to keep up their energy? Are they able to do the things that they love? You know, I refer people to my quality of life video and when to consider euthanasia. That goes over some good quality of life scale calculators you can use, as well as how to manage their pain is another video that we have. So I would go over to those to see if you're doing the appropriate things and see if you need to do more discussions with your vet on how to keep them comfortable. But generally, if it's getting to the point where your animal is not able to get food into their mouth, they're not able to swallow, or if they're having a lot of bleeding, they can actually become anemic. So you may start to see them becoming more weak. Those are going to be signs that you might start to have that conversation with your family that it's time for them. I know this diagnosis for your pet is absolutely devastating. And unfortunately, I wish I had better news that there was better things out there to help treat this disease and this cancer. Unfortunately, I know that they're constantly doing research in this area, but there isn't a lot aside from pursuing really aggressive therapy that we can do to help your pets. So usually I tell people to try to enjoy every moment, try to spoil them rotten, and don't be afraid to hesitate to ask your vet, am I controlling my pet's pain? Am I keeping them comfortable? When do you think it's time I need to pursue euthanasia? I hope this video helps you a little bit. Please don't hesitate to reach out with questions. I am a full-time traveling euthanasia vet. I try to check my videos weekly to see if there's any questions that I can try to help answer here. Thank you.